Okay, so some other important questions which we can see are: a patient had a craniotomy with resection of non-malignant neoplasm of temporal lobe. The patient's vital signs are within the baseline normal range. The nurse observes that the patient has developed bilateral perorbital edema. It's periorbital edema. Which of the following actions would be appropriate for the nurse to take? So, patient had a craniotomy with resection of the. So, patient had a craniotomy. Why craniotomy? Because he had a neoplasm, a cancer in the temporal lobe. So, that is the reason he had to go craniotomy. And the vital signs, it is okay. It is normal. It is within the baseline normal range. The nurse observes that the patient has developed periorbital edema. The patient is having edema in both the eyes. Which of the following actions would be appropriate for the nurse to take? So these are the four options. Apply cold compress to the patient's eye. So for this is for the periorbital edema. So we are asking what is the correct action for the periorbital edema. Apply cold compress to the patient's eyes. Applied warm compress to the patient's eyes. Elevate head of the patient's bed to 60 degree. Elevate bed of the patients to 45 degree. So you can see the answer is D. So head and elevation of 40 degree. Head and elevation of 40 degree is always advisable to reduce the 40 degree is also a correct answer. 45 degree is also a correct answer. So head and elevation of 45 degree, 40 to 45 degree. That's what we say is set as a range. Is the ideal elevation of the head to reduce the periorbital edema, and the same we can see for the reduction of the ICP also. If they are asked about the ICP, again the head and elevation is 30 to 40 degree. Okay, if it is increased ICP, how much head and elevation it is coming under? 30 to 40 degree. So 45 degree head and elevation is required for the reduction of bilateral periorbital edema. Not this application of cold compress and all is wrong. To decrease the incidence of aspiration of gastric contents. So the child is there in a child hospitalization with the severe burns. The nurse should position. So the patient is having severe burns. The person is hospitalized to reduce the gastric content aspiration. Okay, so the answer is flat except during meals. No, that's wrong. Elevate 30 to 45 degrees. So this is always an important question. This elevation. Okay, head and elevation of 30 to 45 degree during the meal. So you have to keep the head and elevated to 45 degree. Okay, the head end should be elevated to 45 degree. So that will reduce the risk of aspiration. It's not only for the burns, for any patient head and elevation of 45 degree during the meals has to be given only during the meals. Only during the meals. Okay, has to be given to reduce the chance of aspiration. Once after you give the meals, the patient can return to the normal position. Next one. A home health nurse visits a patient with diabetes and primary open angle glaucoma. So the person is having glaucoma as well as diabetes. The patient takes metformin 500 mg once a day for diabetes and timolol ophthalmic solution twice a day in the eye for glaucoma. So he has taken metformin, which is a anti-diabetic tablet, and also timolol for glaucoma. Which of the following evaluation indicates that the patient is non-compliant with glaucoma management? So patient, so the patient is having diabetes, he is taking metformin for diabetes. For glaucoma, he is taking timolol, which is a ophthalmic eye drops. Which of the evaluation indicates that the patient is non-compliant with? So the question is with non-compliant glaucoma. So something with glucophage will be the something with timolol will be the question. Patient has not been taking glucophage. Patient has tearing of the eye. Patient has not refilled prescription for timolol for 3 months. Patient has yellowish discharge from the eyes. So it is very easy to answer these questions. You just see. Already The question clearly says which of the following evaluations indicates that the patient is non-compliant with management of glaucoma. So the glaucoma management, what is the glaucoma management in this? Mainly timolol. It is about timolol, isn't it? So something about timolol should be the answer. You have the direct hint from the question that something about timolol should be the answer. So in that aspect, if you just screen the options, patient has not refilled prescription for timolol in the 3 months will be the correct answer. You see? See. Patient is having difficulty with cognitive abilities after a stroke. So the patient had stroke, then there is cognitive ability difficulty. Which part of the brain was most likely affected? So you should understand that cerebrum is always for cognitive ability. Cerebrum. That is the affects the lobe of the brain, the part of the brain for cognition. Medulla oblongata is for what? Respiration. Cerebellum is for what? Balance and coordination. Balance and coordination. Okay, so cognition directly comes with cerebrum. So parts of the brain and its functions are very important. Don't skip that.